Hi, today we're going to be talking about how to do a liquid microtaper. Honestly, this is the best way for the majority of people to taper any psychiatric medication. So what is a liquid microtaper? Well, it's a combination between tapering with a liquid vehicle, so that means either a manufactured liquid version of the drug or a compounded liquid that you specifically make with a compounding pharmacy. So you're going to get your drug in a liquid format, and then you're also going to pair it with something called a microtaper. And so what a microtaper is, it's where you actually lower the dose every single day, or maybe every other day or every 3 days, compared to lowering it more spaced apart. So when I'd say cut and hold, I'd say cut and hold, these kind of bigger jumps, you would lower it once every 14 to 30 days. The reason that you would want to do more frequent reductions is that it can actually be smoother. You don't have to anticipate these big drop downs every 14 to 30 days because you're doing a little reduction every single day. And what I've seen this help with, it's allowed some people to kind of bust through plateaus. So they may find that, hey, I'm not able to go any further, and I've really kind of lowered the amount that I'm reducing with my cut and hold strategy. But when they just can't get any further, they just start lowering it down gradually by a small fraction every day. And typically they're able to get through that plateau and they're able to finish their taper with less symptoms than they would have had if they had done cut and hold. Okay, so let's talk about how you would do a liquid taper with Lexapro. So if you're lucky enough, you've been able to go to the pharmacy and you've got a liquid formulation of your drug. If you couldn't get it from a pharmacy, then you should get it from a compounding pharmacy and just have them make it if it's possible. I always think the best way to do this is to do a 1-to-1 ratio. So that means 1 milligram is equal to 1 milliliter. It makes the math a lot easier. One thing that I should mention is if you get it from a manufacturer, for instance, I got this one from a drug manufacturer, usually the shelf life is a lot longer, and that's one reason why manufacturer versions tend to be better. Okay, so when you're doing a liquid taper, you're going to need some syringes, and we use the Baxter brand of syringes. Those are these orange ones. We like them the most. We'll link them in the description below. But essentially, you'll probably need 2 different types of syringes. You're going to need one syringe that's going to hold the majority of the liquid, and then a very small one if you're going to do a microtaper. Let me just show you how we would do this. So let's say you're on 10 milligrams of Lexapro, and you wanted to come off, you would do your calculation. So let's have a look at how this calculation would work. So I want to do a 5% reduction from 10 milligrams. So I'm going to do 0.05, 5% times 10. And then, that means I'm going to be going down by half a milligram every 30 days. And so what would a half a milligram be if we wanted to divide it into 30 days? So we're doing a drop every day. We would be doing, I guess, 0.016, but that's not going to be an easy thing to microtaper because we don't have that level of precision. I would actually say, let's round up and go to 0.02. And so that's what we would aim for. And let's just do some math just to see if we lowered by 0.02 milliliters or 0.02 milligrams, if we lowered by that amount in 30 days, where would we be? So we'd be at a 6% cut. And so 6%, that's pretty darn good. It makes it way easier to do it with the syringe. And so I'm just going to go with 6% because it's going to be easier to do that level of precision. Here's what I would do, because we're going to be doing such small reductions, the level of that precision, to do 0.02, it's just simply not possible with this syringe. And so we're going to need to use one of the smaller syringes. And so we have a half a milliliter syringe here, and I'll show you how we would do this. I'm going to pull to 9.6 milliliters, and I'll show you what that looks like. I'm going to pull past it, and then I'm going to just kind of get the bubbles out. Okay, so this is a 10 milliliter syringe pulled to 9.6. So we're missing out on the bottom 2 spaces before 10 milliliters, and that's exactly what we want. So I'm going to take this out. I'm going to cap it. And this is where we're going to start to do the real precision work. So here's my half a milliliter syringe, and I'm and I'm gonna put this one in here, and then I'm gonna pull to 0.4. Okay, so as you can see, we left out 2 of the white spaces here, and we pulled to 9.6, and so I'm getting the remaining 10 milliliters in this little one. That's the 0.4. And because we have a half a milliliter syringe, you can see the level of precision actually allows us to lower it down by 0.02, because between each of these, I guess these larger decreases, so we have like 0.4 and 0.5, we have 10 spaces between there. So that will allow us to lower it down now by 2 spaces, and 2 of those spaces would be 0.02. And so for the first reduction, I would just push this up 2 white spaces, and that's my first day. And then the next day, when I draw it out, I would push it further by 2. And then the next day, I would push it further by 2. And the next day by 2, and so on and so forth. Eventually, I'm going to finish this one, and that would mean I'm at 9.6. And then you would just, essentially, you would pull this one less, and then you would go down. I'm only going to pull the big one to 9.2, and then you would keep on using this as you went down to really do those precise reductions. And so that's how you would do a liquid microtaper, and that is really probably the most precise way you could do about this. I know it seems kind of complicated, but once you get into the swing of it, it's really as simple as brushing your teeth, and it's super fast. You just whack your big syringe in, you pull up as much as you can, and then you get your precise one, and then you use that one to make those tiny daily reductions.